Good morning, everyone. My name is Melanie Chasteen, and I am the Director of Community Engagement at the Texas Campaign to Prevent Teen Pregnancy. Thank you for joining us for this webinar, where we will explore how 3 Texas communities, Austin, Odessa, and San Antonio, work to challenge the status quo and implement evidence-informed sex ed programs in their respective districts. We are extremely excited to be hosting this session and to have this panel of speakers with us today. Before we get into the content of today's webinar, I want to share a few tips for using the webinar platform and a bit of background information about the Texas campaign. First, we have muted all participants to help reduce background noise, but welcome your participation and questions using the Q&A function you see at the bottom of your screen. If you have questions for one of our presenters, please submit it using that tool. We will have time for questions at the end of the webinar. Also, we will email a PDF version of the slides to all participants following the webinar, and we'll put both the slide deck and an audio recording on our website at txcampaign.org by the end of this week. Finally, we ask that you share your feedback via a brief survey that will launch as soon as you exit the webinar. We will also email it out following the session. For those who are seeking continuing education credits, this evaluation is required. I want to extend a warm welcome once again to our partners and colleagues from across the state. For those who may be engaging with us for the first time, the Texas Campaign to Prevent Teen Pregnancy is a statewide, nonpartisan, nonprofit organization dedicated to reducing teen pregnancy through research and data dissemination, advocacy for effective public policies, strategic collaborations, and training and events. This is our 7th and final webinar of 2019, but we have much more planned for 2020. Registration information about those will be out shortly. As I mentioned, we couldn't be more excited about the panel of speakers joining us today. They each were instrumental in their respective communities in making progress on this issue. We'll begin by having them each provide a brief introduction for themselves. We'll start off with Suzanne.
Hello, my name is Suzanne Kearns. I live in the Austin ISD, and I have a 9th and a 4th grader in our district. I'm a stay-at-home mom, but because of a situation in my kids' schools a couple years ago, it was kind of someone should really fix this problem, and it ended up being that no one else wanted to fix it, so I stepped up and started a group called the Informed Parents of Austin to help support LGBTQ students and families in our district, and that then evolved into supporting comprehensive and an LGBTQ inclusive sex ed in our district. So our goal for our group has really been to focus our time and energy with people who can influence and enact change. This is the SHAC, the school board, and then working on a school-by-school level at our CACs. I started my advocacy by attending SHAC meetings and then eventually became a SHAC board member. But I do want to clarify that all my statements today are basically from a perspective of Informed Parents of Austin, not as a representative of the SHAC. I don't want to get in trouble.
Thank you so much, Suzanne. Dr. Plattner?
Hi, I'm Dr. Lisa Plattner from Texas Tech Health Sciences Center on the Odessa campus. I am a nurse who is also a PhD. I've been a nurse for over 40 years and have served in several capacities that way. My current capacity is serving as the coordinator of the Human Growth and Development Program for Ector County Independent School District. I have 2 grown sons that I took care of their sex ed, and I just felt like I needed to do something to help some of the other kids that are out there, particularly with our rates in this area.
Wonderful, thank you. All right, Melissa?
Hi, I'm Melissa Munsell with Northeast ISD in San Antonio. I'm an instructional specialist in the PE and health department. In that capacity, I work as the health education lead for the district and work with all of our health curricula, K through 12. I also help coordinate and implement any of our human sexuality and abstinence education curricula at the secondary level, which is middle school and high school. This is my 20th year with Northeast ISD. I taught and coached at one of our high schools, taught health education And then this is my 10th year in this position, and I'm excited about being able to share our Northeast ISD story today.
Thanks, Melissa. And last but not least, our very own Jen Biendo.
Hi, I'm Jen Biendo. I am policy and data analyst for the Texas Campaign to Prevent Teen Pregnancy. And so I work primarily at the state level, but also at the federal and local level to shape policies that help increase the access of Texas teens for healthcare and information that they need to make healthy choices about their futures. And I'm also the proud parent of 2 boys who are both students in Austin ISD.
Thank you, everyone. So a quick piece of information related to the flow of today's webinar. We are going to do a round robin where each speaker will give an overview of their work in their respective districts. They'll then talk about the challenges they experienced, and they'll conclude with lessons learned. Before we begin, we'd like to do a very quick poll and then start out with a brief summary about what Texas law says about sex ed.
And we'll give just another minute for the poll. And so we're seeing a lot of Central Texas people, also Houston, Fort Worth, Dallas, San Antonio, Rio Grande Valley, and also some folks joining us from outside of Texas. Wonderful. So we're very glad to have such a great distribution of folks from all across the state. We've got Gulf Coast coming in, Rio Grande Valley.
Nice.
Great. Wonderful. So we're so glad to have you all with us today. And again, this is Jennifer Biendo with the Texas Campaign. And so to start us off, I would love to just give a little bit of a framework for why sex education is so important for our youth. And if you're with us here on the webinar today, we're probably preaching to the choir, but we know that sex education is critical for helping children and adolescents make informed, positive, and safe choices about healthy relationships, responsible sexual activity, and their reproductive health. And that is a statement from the American Academy of Pediatrics on the importance of sex ed. So we do know that sex education is important for prevention efforts for things like unintended pregnancy, HIV, and sexually transmitted infections. And this prevention framework is important, but we also know that sex education can be considered a basic human right. We want our youth to have medically accurate information about their health and their bodies. In this Me Too era, we know that sex ed is critically important for teaching youth about things like consent and sexual abuse prevention and sexual violence prevention and healthy relationships. We also know that sex ed can play a key role in reducing inequities, like mental health issues that we can see from our LGBTQ youth, which may be associated with being raised in a shameful environment. We know that inclusive sex ed is important for all of our youth to be healthy and happy with their own relationships. And finally, we know that much of Texas teaches abstinence-only policies. The evidence is strong that abstinence-only policies can create harm by withholding critical information and using shame-based tactics. All across Texas today, we still hear many, many stories of youth who are told that if they're sexually active, they're like a piece of chewing gum that's been chewed up and shared around, or they're like a present that's been ripped apart. These kind of shame-based tactics can cause real harm in our youth. So what's the policy framework that we see for sex education in Texas? So we do have some state statute that lays out a basic framework, and most of this can be found in Chapter 28 of the Texas Education Code. I will not read you the actual statute because it's very long and somewhat convoluted, but I can give you the highlights. So in Texas, health classes are electives at the high school level. They are not required for graduation. And since this change was made about a decade ago, we see that many students don't get sex ed at all. only about 16% of high school districts offer what we consider to be comprehensive and medically accurate sex education. These are primarily urban districts that have large numbers of students. So fortunately, more than 16% of Texas students do get evidence-based sex ed. So what is the process for setting up sex ed? So this is a district by district process. So this means that all of the 1,200 plus school districts in Texas can have their own sex ed curriculum, but they do have to follow certain guidelines. So under state law, districts are required to set up what's called school health advisory councils, or SHACs. And these SHACs are intended to ensure that local community values are reflected in sex education. Any sex ed curricula must be selected by district trustees with input from the SHAC. So this is a very important point. Under state statute, any sex education classes must prevent abstinence as the preferred choice of behavior for unmarried people of school age, and they must devote more time to abstinence than any other activity and stress the effectiveness of abstinence over other methods. However, school districts do have the option of offering what we call abstinence plus curricula, which does stress abstinence, but also offers additional information on things like contraception, prevention of sexually transmitted infections, healthy relationships, inclusivity of all sexual orientations. So this is an option that school districts do have. However, state statute prevents school districts from distributing condoms in connection with human sexuality instruction. Parents receive notice of whether the district will provide sex ed and a summary of the basic content. Additionally, all parents have the right to opt their children out of the curriculum for any of the lessons. And finally, the curriculum standards, which are the Texas Essential Knowledge and Skills, or TEKS, are set by the State Board of Education. And we'll have more on that at the end of this presentation.
Thanks so much, Jen. So we're going to start out the round robin with Suzanne Kearns talking about Austin ISD.
All right, yes. So one of the challenges is that just because we live in Austin, which is usually seen as the little blue liberal bubble in Texas, people assume that it would be really easy to pass comprehensive and inclusive sex education, which I have discovered is not the case. So the one thing that we do have working in our favor is that the primary decision makers are in favor. Like I said, the board, well, actually, I did not say this. Spoiler alert, the board just unanimously passed our comprehensive and inclusive sex ed. So they are definitely in favor, as is the health department, which developed the curriculum, the SHAC, which is the School Health Advisory Council, which helped put together the request for proposals and set up the original structure, worked with the school to put together the original structure of the scope and sequence of the lessons, the board of trustees, and as well as the parents and community. We did a survey last November that showed that 94+% of parents and guardians are supportive of the district-wide, of the curriculum. You can actually see these results if you go to Austin ISD Health. You can click on survey results and see all those broken down by the scope and sequence. Primarily, the opposition are non-parents, non-AISD representatives from like Texas Values, Concerned Parents of Texas. So that is frustrating because they have basically been able to share this misinformation for otherwise supportive parents who now, because they're scared by the data or information that's been shared, they don't know what to know is true or false. So the Austin AISD story. Our lessons were originally done, last updated in 2010, and then the SHAC finally requested that the district begin to update the scope and sequence in 2016. Just to let you know, our elementary school was originally healthteacher.com, which then became Go Noodle, which is obviously, if anybody's familiar with that, not a sex ed curriculum anymore, so very outdated. And the middle school had been an edited version of Big Decisions, which is actually a high school curriculum that was tailored for a middle school audience. So again, not ideal. The district used the National Sexuality Education Standards to develop the scope and sequence, and then moved forward with that survey around that in November 2018. And once that was approved, the board unanimously approved it in February, which then set them forward to actual lesson development. The lessons originally were the grades 3 through 5 were done by the district, and 6 through 8 were originally Get Real. Unfortunately, due to SB 22, we had to scrap the Get Real curriculum because of the associations with Planned Parenthood. So they went back to the drawing board and spent the summer putting together grades 6 through 8 done by the district as well. So all of these lessons were then available for the public to view online and then do a survey in September. And then the SHAC unanimously approved those lessons, and the ISD board again unanimously approved the lessons just last month, which now the teachers are all being trained on and should start being taught in May 2020. And if anybody would like to look at any of those lessons, those are all available online the same way if you just search Austin ISD Health.
Thank you, Suzanne. And now Dr. Plattner will take us through Ector County ISD.
The first thing I'd like to say is, especially in, well, anywhere in Texas, anytime you want to start something like this, it really helps to have a team of people. And I'd be amiss not to give credit to Dr. Elisa Brown and Dr. Gracie Flores for their part in getting this started in Ector County. I came on later on and it's been part of my passion as well. The medical students of the Permian Basin campus, they came to the Permian Basin campus in 2009, and they had been doing straight talk curriculum in Lubbock and wanted to come back and continue that here. Well, that didn't work. Our area was a little bit more conservative, so they wanted to hear something a little bit different. But Dr. Brown and Gracie went to SHAC, and actually Dr. Flores became a part of SHAC because she has a son in the age group in that Ector County ISD. So with SHAC research for absence plus curriculum, they finally came down to an abbreviated version of Big Decisions. As mentioned before, Big Decisions was aimed at a high school crowd, but we took the lessons out of there with Dr. Riolini's approval to cover the needs of Ector County Independent Health, or Ector County Independent School District. The only thing that was working in our area before we started was an abstinence-only organization, which at first there was a little bit of disagreement on what we should be doing and who should be doing it. But we have a wonderful relationship with that group now. Sometimes we just have to agree to disagree on certain things, and their strengths are things on the social issues and so forth, whereas Texas Tech tries to handle the medical or the scientific part of reproduction. Now we use staff and volunteers to present it actually in the 7th grade classes of all of Ector County Independent School District. And we have just almost, we've got 1 or 2 more classes left. We've almost finished for the school year.
Great. Thank you so much, Dr. Plattner. And so now we'll hear about Northeast ISD.
So in Northeast ISD, a little history about our sex ed programs. Prior to 2008, at the middle school and the high school levels, we used a condensed version of Worth the Wait. And these programs at both levels were taught exclusively by our school nurses, which we love our school nurses, but they didn't have a rapport with the students, and it wasn't really a great situation for our classes as a whole. In fall of 2008, we implemented at the middle school level choosing the best, and then at the high school level, big decisions. And these were taught in a combination by our PE and health teachers and by our school nurses. And then a few years later, we were able to teach those programs exclusively by our PE and our health teachers. In the fall of 2016, at the middle school level, we adopted Draw the Line, Respect the Line. And then just kind of a few extras about Northeast. We are an active consent district, meaning that our parents and our students have to opt into the program with a yes. So everyone does have to turn in a parent permission form. And then as far as parent previews, at the middle school level, we do hold a parent preview meeting at each of our middle school campuses. At the high school level, we hold a parent preview that is district-wide, 2 parent previews each semester. We have very low attendance at those parent previews, so we also offer an online option for both the middle school and the high school programs. And these are available on our district website via our Skyward Family Access page, which is a password-protected page for our parents. Around 2011, 2012, we began a discussion of evidence-based programs, wanting to implement evidence-based programs. And this was with input from our SHAC, Classroom Health Subcommittee. We have an extremely strong SHAC in Northeast, and we do great subcommittee work. So in 2013, we did a full review of both of our middle school and high school programs. And again, this was with SHAC subcommittee and district staff doing this review. We also began looking at our district data as far as our reported teen pregnancies. And then we began collecting data on our parent preview participation, as well as our program participation as a whole. So we started tracking our form collection and just keeping our data, which really helped us in the long run. And in addition, some of our teachers and myself did some observations and some training in some of the different evidence-based programs that were being taught in the San Antonio area schools. In 2015, 2016, we made the decision, and this is again SHAC subcommittee and district staff together made the decision to stay with our high school program. We felt like our high school program was solid, which was big decisions. So we began work on our middle school level, which is where we felt we needed the focus and a change. And so we began steps to adopt a new program. We used the iChamps model as our tool, which is a tool that is through the UT Health School of Public Health. And we also used expertise from some of our local partners, local experts in the field, Project Worth, which is a group through our Metro Health, as well as UT Teen Health, which is through UT Health as well. And we went through appropriate steps. Our final subcommittee choice was Draw the Line, Respect the Line. It went to full SHAC vote, which was approved. Then it went to our district executive staff, and then finally to our school board for unanimous approval.
Great, thank you so much, Melissa. And so now the panelists will do a round robin on some of the challenges that they encountered improving sex ed within their own districts. And so we'll start with Suzanne and Austin ISD.
So yeah, in Austin ISD, we've seen this, but I've also seen this in the other districts within Austin, is that we had a lot of over-representation by anti-groups. So when I'm kind of using this abbreviation of anti-groups, that's pretty much anti-sex ed or anti-LGBTQ. Doesn't necessarily mean that they represent both, but that's kind of how I'm lumping them together. So what we've run into is that whether it's in an article, someone being interviewed, or at the board meetings, we're seeing a really high percentage of non-parents, people with no school-age kids, definitely kind of in the 60 plus. Granted, there are probably some grandparents who are care providers, but for the most part, these are people who do not even have kids actively in school or even in our district. So, you know, they have fewer conflicts, especially our last board meeting was 3 days before Halloween. It was really hard to get, you know, parents who are busy. It's a school night. That meeting ran till 1:30 in the morning. That's hard to do. So it's just a much higher overrepresentation by these anti-groups who can bring in older individuals who don't have the same type of complex that parents do, which goes hand in hand with the underrepresentation by the supporters. Part of it is a lot of people just think that Austin is safe. A lot of people I talk to assume that these lessons are already being taught. So they don't understand it's not a real urgency because they think they're in a safe space. And like I said, parents are busy. It's a big ask to get people to, you know, put aside everything that they have to do, kids' music lessons, whatever, get dinner ready to go, set aside for a few hours on a Monday night. But one of the saddest things that I've seen over and over is that the parents of LGBTQ kids, as well as LGBTQ parents, are really hesitant to put this target on themselves and their families by standing up, which is one of the main reasons that we started Informed Parents of Austin, was to be this ally group where basically the LGBTQ megaphone from, you know, suburban cisgender heterosexual communities to be the voices, or at least help amplify the voices of these families that maybe aren't in a place where they can speak up in a public forum. And the misinformation by these anti-groups, even once our sex ed curriculum was just approved, it was so bad to the point that there had to be a Snopes report because they were saying that their fourth grade lessons included lessons on how to have better anal sex. And this made the rounds big time. Well-meaning parents who were like, wow, I really thought I supported this, but that sounds a little extreme, which I think we would all agree that would be extreme for a fourth grade classroom. Snopes put that to bed, but it's still running rampant through a lot of, you know, these conservative right-wing, I don't want to even say necessarily right-wing, but these really conservative anti-groups that are trying to spread fear among the well-meaning parents.
Thank you so much, Suzanne. And so now we'll go to Ector County.
Ector County is a very conservative community, especially when you compare it to Austin. I know that Austin is more conservative than what they're saying we are, but I think that Ector County is a little bit more conservative than just about anybody. Even though we have some of the highest teen pregnancy and teen STD rates in the state. We have an abstinence-only curriculum that's been around longer than we have. It's a faith-based organization. They are a sole provider of services, meaning that they have STD testing, they have pregnancy testing, they have loss testing, and things like that, which is all well and good, but there's other things that are definitely missing in our area. For example, Planned Parenthood does not exist in our area at all. They have to go to one of the bigger cities to get anything like that. We have time constraints due to standardized testing. Our schools have recently had some failures, and so they're more focused on trying to get the standardized testing, and the sex ed, as far as the school board goes, is not as important to them as in our opinion, it should be. They have an abbreviated curriculum that we use an abbreviated curriculum in order to fit into there the best we can. And we try to work around the tests. And we've been able to do that for the most part, reasonably well. We do have a shortage of volunteers. The med students started this all off, but then they got interested in other things, and we kept carrying on with residents and with with some of the physicians and the OBGYN and family practice areas. But now we're getting the med students coming back and helping us even more. And in fact, this year we've got the residents from psychology, or from the psychology department, coming and helping us teach it as well. The demands of the school district are getting higher and higher, and by that we mean they're not giving us any manpower anymore due to budget cuts, and also due to the lack of people. Everybody wants to go work in the oil field, not working in the school district necessarily. One thing I did want to add to this is, as far as the LGBTQ, we have our hands tied as far as that goes, because Ector County has not at all addressed this. It's kind of like maybe if we just don't say anything, that it will go away, which we have gone a couple of times to the SHAC and made recommendations that they address the issue in some form so we know how to proceed. But at this point, we're not allowed to do anything like that.
Great, thank you so much, Lisa. And so now we'll look at challenges in Northeast ISD.
So in Northeast ISD, I think we had a lot of the same challenges similar to Austin ISD. We had a small group of parents that were very vocal with their concerns. And I think there were probably non-parents mixed into that small group as well. They attended and demonstrated at our full SHAC approval meeting. The same thing at board meetings during our approval process. They released press releases and had media interviews with our local stations. And again, kind of like in Austin ISD, they spread or shared false and misleading claims about the curriculum and about the district. They also set up a series of seminars that were not sponsored by Northeast, but they were titled NEISD Sex Ed Parent Education Seminars. And again, where they created confusion and needless controversy with what was shared with the audiences. They also, in next slide, they also delivered robocalls to Northeast households. They set up a web page as well as a Facebook page, again with inaccurate and misleading information. We didn't hit Snopes, I don't think, but there was a lot of misinformation out there. They also inundated our department and our district with 36 open records acts, and then utilized the local grievance process, which actually went all the way to the Texas Education Agency, to TEA. But through all of this, our position and our decision was upheld not only by our school district officials and our school board, but also by the state.
Great, thank you so much, Melissa. So we'll go to our round robin on lessons learned. And I want to remind you that if you do have any questions that come up, you can use the Q&A function on the black bar on the bottom of your screen. We've got a couple of questions coming in, and we'll answer all questions towards the end of the webinar, but please ask those questions as you think of them. And so now Suzanne will take us through lessons learned in Austin.
Yeah, a lot of what Melissa just alluded to, we ran into on the SHAC board. A lot of grievances filed, a lot of open records requests. In fact, we just got another one where even my personal emails to board meetings were requested. So what that leads into is knowing and following the process and bylaws. The sex ed approval process was held up for over a year due to misunderstandings with the SHAC, issues with the SHAC bylaws. and by all means, we should be following those laws, but they will just find any little nook or cranny they can to build a wedge. And we literally had to dissolve and reassemble our SHAC between June and September of this year because of that. So it's just know every little tiny subsection of any law and make sure that you are following that to the letter. Transparency, transparency, transparency. No matter what you do, there's going to be a perceived lack of transparency. So just make it over the top, especially because, as we mentioned before, parents are really busy. Sometimes just them not checking their email can be seen as a lack of transparency because they didn't open it even though you sent it. And also making sure that things are available in multiple languages. That became an issue if anything was not available, or there wasn't a Spanish translator available. That was considered a lack of transparency, and definitely something to honor the families that do speak Spanish only as an important part. And if you're going to be collecting data, which I do encourage because that's the thing that really moved the needle with some parents, collecting data and surveys, I would encourage that those are designed by neutral professionals. Again, the anti-groups were able to dive in there and find anything that was not, or it could anyway be seen as biased or not done in the perfect method, and use that to tear apart and try and invalidate the data. Just personally, I think that more student voices should be included. We tried to get more GSA, which are the Gay Straight Alliance, participation, just because our group is specific to getting the LGBTQ inclusive sex ed. But for any means, I think that hearing the student voices of what they really need, they are seeing what goes down in their day-to-day lives, and should be speaking about what they need to make sure that they are healthy and they have the information that they need. If you have a particular group that would be contacted by the media to provide reports or point of view, just make sure that you have like a chain of people that are ready to go with talking points. And know who is comfortable to do that, because I have found that media requests come in really quickly and you usually don't have a lot of turnaround or a lot of notice. And then also be aware of the news outlets that are biased. There's a real risk, and we've learned the hard way, of having words twisted or having them kind of cherry picked to fit whatever the narrative of a particular article is. And our guiding mission for our particular group is really trying to fight for something, not against someone. So it's hard to do sometimes when some of these anti-groups can be really frustrating and you just want to yell at them or try to argue their points. But they're not the ones who are going to make the decision in the long run. So we just try to make sure we get the information that we need to the people who can actually make decisions.
Thank you, Suzanne. And Dr. Plattner, you can talk about lessons learned in Ector County ISD.
I have to say ditto to Austin, because a lot of what she said is lessons we learned here in Ector County as well. First thing, the SHAC should be included in the planning efforts and implementation. And that includes making sure that they are educated on all the bylaws as well as your own team. Another thing that we have been doing is collecting data to make it more scientific and easier to argue the point that we're trying to get across. Transparency, transparency, transparency. Can't say that enough. Because if somebody will find something that you forgot to be transparent about, even without intentionally doing that. There's funding and grants for services to help pay for some of these programs. Be aware of those and use that money to help further your cause. That's how I obtained this position, and so I could spend more time on helping to coordinate this. Partnering with other organizations is another good thing to do. Like I said, we partner with the Life Center, which is a faith-based organization that's abstinence only. But we've decided that we cover one part better and they cover the other part better. So we just work together. Being patient is a real good attribute too. Sometimes we let our emotions and our passions get in the way of trying to get to a certain point with some of these things, and trying to keep the emotions out of the whole picture, even though it is a very emotional issue for a lot of us.
Great. Thank you so much, Dr. Plattner. And now, Melissa, if you could do lessons learned for Northeast ISD.
Absolutely. I think, first of all, to echo what Dr. Plattner said, be patient. We took years to adopt our new program. And so make sure that you allot plenty of time for your process. And then to echo what Suzanne said, follow your process, know your process, dot your I's and cross your T's. Use the data that you have within your district, know what your district needs, know your community needs, know your campus needs, know what your students need. And then, go find what they need. Again, we use the ICHAMPS model, so we felt like we had a very structured, clear pathway to our adoption process, and then also use whatever other available tools that you have within your district, as well as within your community. Utilize your community resources. Transparency, transparency, transparency. I think probably all three of us couldn't say that enough. Be completely transparent. Keep your senior leadership within your district. Make sure that they know what's going on so that there are no surprises from them. And that's part of that transparency piece. Not only transparent with your community, but also within your district itself. If you do have resistance, be prepared with a response to deal with that resistance, and then directly counter misinformation and opposition. I think our district leadership and our director of communications within our district did an awesome job of that. Have a great rapport. Know what rapport you have with your parents and with your community. We had a lot of parents and community support that went to bat for our decision and backed the decision that we made. And then just kind of from an administrative school district standpoint, make sure that your teachers know what you're doing. They need to buy in to any changes, and we had a lot of teacher input. Make sure that you train them well. So we had targeted professional development as far as training with the program. Have a good rapport with your teachers from the administrative level, and then protect your teachers from the controversy. Give them, be there to support them at the campus level. So whether it's parent preview meetings or questions that come up, make sure that they have the tools that they need to deal with that. And then one of the things that I think we have done a great job of is we have continued to gather the data that we started gathering back in like 2012. We're still gathering data on how many parents attend our parent preview meetings, our actual physical meetings. Those numbers have actually decreased even with a change in program. Our online numbers are incredible. We have thousands of hits on our online parent preview program. And then after we changed the program, we saw that our program participation numbers did not change. We stayed with being an opt-in district, and we still have around 94% of our parents turn forms back in with a yes on those. So we have around 94% kind of give and take. So the majority of our students. So we feel like that's a great reflection. Our parents trust the decision that we have made, and they feel like their students are in good hands with the teaching that they are getting.
Great, thank you so much, Melissa. And so now we'll take it back to the statewide level. So we wanted to provide attendees with a quick update on some upcoming revisions to the health curriculum that will be taking place at the State Board of Education, or SBOE. So the SBOE is preparing to revise the Texas Essential Knowledge and Skills, or what we call TEKS, which are the curriculum standards that guide health education. And health education includes many things like nutrition and other elements, but it also includes sex education. So these were last revised in the late 90s, in the year that the Titanic came out. So it's definitely time for some updates there. So hearings are anticipated to be held among the SBOE next summer, and a vote is expected next fall. There are currently work groups that are reviewing the existing curriculum standards and providing recommendations. And so there are some things that you can do. So the SBOE is an elected body with districts. So one of the most important things that you can do is reach out to your own SBOE member and let them know that you support evidence-based sex education that goes beyond just abstinence. If you want more information on how to find your SBOE member and how to reach out to them, you can go to the Texas Campaign website and click on the Advocacy and Sex Education tab and get some more information there, and we'll continuing to be populating that with resources. Additionally, if you are an expert in sex education, you can apply to serve on these review work groups. And again, we have links to that work group application on the website. And finally, you can sign up for Texas Campaign notifications and receive action alerts. We'll be keeping you posted on how this process goes. All right, and we have a few resources as well. We don't have the Texas Campaign webpage listed there, but that is also a resource. And then these are some other links that you can look to if you want some more information on what evidence-based sex education means and how to implement that within your district.
All right, and now we would like to open up the webinar for questions. As a reminder, you can use the Q&A button on the bottom of your screen to ask questions. We've already had a few come in, so I'll just go ahead and start off with, and this one might be for Melissa because I remember she mentioned the opt-in thing, the permission that they use. Have you considered an opt-out permission slip? What is your rate of opt-in?
So we have discussed going to opt out, but that has not happened. It would be a lot easier, certainly for our teachers, not to have to collect a form from every student. But we are still currently opt-in, which, you know, our rates, we have around a 94% opt-in rate. So so we think that's a great percentage.
Nice.
That certainly is. Thank you, Melissa.
The next question is, someone wants to know if any of you have any advice on the types of grants that support these programs and where to find them.
And I think this may be in reference to what Dr. Plattner was mentioning about grants that could support education. Dr. Plattner, would you like to take this?
Sure. The best place to go look for grants is grants.gov, and put in adolescent, and they've got all kinds of adolescent grants. There's a new one coming up that is going to be due in January, so you'd have to hurry and get into that. But again, grants.gov is the best place to find them, and they're primarily government grants.
Thank you so much, Dr. Plattner. This next question, Suzanne, maybe you want to take this one. How do you call out the naysayers without creating something of a sensationalized battle? Did you have board and SHAC reach out to media platforms to correct information.
And it looks like this will be for Suzanne and then also for Melissa. So Suzanne, why don't you go first, and then maybe Melissa can jump in.
Yeah, let's see. So naysayers, I mean, they come in a different level. So there are, like I said, there's parents who just have legitimate questions, which I wouldn't necessarily call them naysayers. They're just kind of more questioning and searching for more information. The groups that have been speaking out against sex ed in Austin ISD, I don't, and we do as much as we can to spread the correct information and share the correct information with the parents, and making sure we share that with the SHAC or the board. I don't know on a school level, just because I don't directly have involvement with the district, so I don't know what they do to correct information. But I know that Snopes article that I mentioned, it did appear that probably, I don't know if Snopes reached out to the district or if the district reached out to them, but it did seem to have an official answer to it that they probably got from someone, but I don't know which direction that correction came from. I don't know if it came from the district or if it was a request from Snopes to get a comment from the district. But as far as our particular group, the Informed Parents of Austin, we just try to share articles. We try to direct people, especially when there's misinformation about the lessons. The lessons are available online. So that's kind of our number one retort if someone says, well, did you know that there's such and such, and it sounds really sensational. We encourage them to find that bit of information in the lessons, and then we can continue a discussion. But a lot of times the stuff that people are riled up about doesn't actually even exist. So it's kind of a non-argument point, because it's not even a fact.
All right.
And Melissa, do you want to give any response to that question as well?
I think what our district administration did, as well as our director of communications, was just to send out the correct information.
Okay.
Mm-hmm. And
May I add something? This is Dr. Plattner.
Absolutely, please.
One thing I would say is, if at all possible, make sure that information goes directly to the person who's making the claim. What happens in our district is we have a liaison with the school system through the SHAC, and this person, if he gets any complaints or anything, he brings them to us so that we can answer them to him, and then it goes back to the parent, and that seems to work better than anything.
That's great. And then we have another question for Dr. Plattner. So regarding Ector ISD, what was your approach to connecting with faith-based communities?
Well, primarily like what Suzanne said, is not focus on where we're different, but focus on where we're alike. Everybody agrees that abstinence would be the best thing. We just say that sometimes abstinence isn't always the answer for a certain individual, and they need to be educated in how they can protect themselves if they make that choice. And that's the main place where we have any friction at all. And we've got some new people in there, well, not new anymore, but some people that are, we listen to each other. We're part of the same coalitions, and we've just decided that we were going to look at where we agree rather than where we disagree.
That's great. So on that note, we will close out the webinar.
And thank you again, everyone, for being with us this morning. A special thanks to our panelists. Slides will be shared via email. They'll also be on our website along with the audio. And once you close out of the webinar, a brief evaluation will launch. We ask that you please complete that. And remember that those seeking continuing education credits must complete the survey to receive their CE certificate. Thanks, everyone. Have a great day.